The global pandemic of COVID-19 continues to wreak havoc across the world, and in the chaos, some services are more impacted than others. I have talked to service providers as well as distributors in Uganda and Kenya to find out what the situation is on the ground. Richard Mugenyi, who is the Advocacy and Communications Manager at Reproductive Health Uganda, says right now the situation is not so great.
Most of the providers, we've suspended outreaches. And you know that I think we reach most women, most girls, most men who get sexual reproductive health through outreaches. We go to the communities and we offer services from the communities. Now, with suspension of that, that means that there are many people who are missing out. Of course, as RHU, we've stopped 5 of our clinics since Tuesday, 3 in Kampala because of the transport, but when that is cleared, they will resume work.
RHU has another challenge. They've suspended most of their outreaches. These get to the most underserved in the communities. Also suspended are the community health workers, the peer educators, as well as the community champions. This is definitely going to impact on access.
We do more than 65% of our client reach. We get them to the communities. Maybe around 35% or less at the static clinics.
With partners like the Ministry of Health as well as FHI 360, Reproductive Health Uganda hopes that drugstores as well as private clinics will remain stocked as these are nearer the people and they'll be giving them services. However, in Kenya, Lorraine Archer, who is the Regional Director of DKT International, has fears that providers may not be that open.
Health providers very quickly were hesitant to see our medical reps. I know in Kenya they very immediately had put a stop to visitors in terms of us reminding them about stocking IUDs for their patients.
Paul Emi, who is the National Sales Manager for DKT International in Uganda, has no fears at the moment over stockouts. His main worry is the ban of private vehicles moving on the road and the slow process of getting stickers.
The good thing is we've tried to work with Jumia to avail condoms online. So people can purchase condoms online, which is a good thing. But the ethical products now becomes a challenge for us because with ethical products, you have to sell them in ethical outlets. Now getting to those outlets is the big challenge for us.
In Kenya, we're not quite to that point yet. So theoretically, women could still access some long-term methods now, but it depends, again, on the provider's willingness.
And if this lockdown goes on for a very long time, you reach a point where people cannot even afford to buy probably a condom of 1,000 shillings. You can see already people are complaining about food, just a few days of the lockdown. Now, you just imagine the situation if this went on for probably a month or so. At some point, people will have to make choices. Do I buy food? Do I buy a condom?
For a long time, the Ministry of Health has been hoping that most Ugandans would increase demand for contraceptives. That is likely to happen during this period when most people are locked down. But are they ready to meet this demand?
We have the commodities to meet the demand. At national medical stores and the joint medical stores, I think they have the commodities. The only thing is, can those commodities get to the facilities where they are needed?
Understandably, the Ministry of Health officials are busy. They are occupied with COVID-19. I've tried to reach out to them to assure the public about the situation with SRH, and hopefully this will be soon. Florence Blondel for NTV here in London.